March is Colorectal Cancer Awareness Month, and Dr. Alan Chudzinski is back from the Digestive Health Institute at Advent Health Tampa, and he's here to discuss what you should do or how you can help someone who has been diagnosed with colorectal cancer. Welcome back. How are you?
Very well. Thank you so much for having me back.
I enjoyed talking with you the last time. I remember it being so educational, and we kind of broke down some stereotypes, and I think that's what we're doing right now in a very important month. Now, I don't know about you. Obviously, in your field's a different mine. I feel like I'm hearing more about colorectal cancer in the headlines. I'm knowing more people getting diagnosed. What are your thoughts? So important to talk about it this month.
Sure. I think, well, there's a few things going forward with that. And that one is that the message is getting out there, and that we are pushing people to get screened more often. And if you have a problem, getting in to see your physician, letting them know, to not be worried or scared or upset about talking about things when you're having some signs or symptoms. So I think that has been key with getting people in and getting an earlier diagnosis.
Again, we've talked before, and you know my history with Crohn's disease
Sure.
and things. It seems like there's such a stigma that when people do have these symptoms, they're gross. They don't want to talk about it. They just want to put it on the back burner. Remind people that this is the stuff you talk about every day, so you're not going to be fazed about it.
Absolutely. I mean, it's a normal part of our body function. We do it, and it's something we don't always like to talk about, but there can be problems that arise and go wrong. So it's really important to feel comfortable with your primary care doctor, or to get in touch with a gastroenterologist, or get in touch with a colorectal surgeon if need be, so that you can speak about those things. I mean, family members should and can be talking about it. There's a lot of grandparents and parents that have had problems, and people in your own community that have had these things. The key really is prevention. That's why Colorectal Cancer Awareness Month is important to us, because we go out and talk about how easily preventable some of this is by getting a screening colonoscopy.
And again, people think colonoscopy, that's not something I want to do, but you really do make it easy, and we've talked about how important it is.
It has changed so much from a lot of the stereotypes and concerns that people have about it. It's a much gentler, easier prep where you take some powdered formula and a sports beverage, and that's it. You drink water, clear fluids, and some Jell-O the day before. You're completely asleep. You wake up, and most of my patients can't even believe that it's over. That it's done. And the key is to find these little polyps. Polyps can be irregular growths that appear on the surface, internal surface of the colon. By finding that polyp, you can cut that out and never have to worry about that becoming a cancer, because over time, that is indeed what will become cancerous.
And unfortunately, sometimes you do have to deliver the news that people do have a diagnosis. Let's talk about treatment options. And I know you talk about urgency, which when you hear a diagnosis, people want to move right away, but sometimes you have to wait, which is something that you are completely against.
There's nothing more concerning to a patient being told that they need to see a surgeon, they have a problem, a mass, or a cancer, and that patient wants it out immediately, and that's very understandable. At Advent Health Tampa, we have a policy that if you're diagnosed or been told that you have a mass or cancer, we'll see you within 5 business days, and we'll help to set getting your surgery scheduled or getting some treatment before surgery if necessary. There's different ways that we treat sometimes colon and rectal cancer depending on where it's at. Ultimately, it all leads to surgery, but the great thing about surgery for us, with colon and rectal surgery in particular, we've really pushed the envelopes on minimally invasive surgery. So much smaller incisions, and we do most of our things robotically. Now, when I say robotically, I'm not talking about an autonomous robot that I'm just sitting back in a chair and letting the robot do the surgery. I'm controlling these robotic arms. So it's really an extension of myself as a surgeon by using these robotic arms that can make near 360-degree motions through very small incisions being placed inside the abdomen and pelvis. This allows a patient to recover much quicker. The evening of surgery, patients are sitting in a chair, they're eating ice chips and drinking fluids. The next day, they're drinking clear fluids and walking around the hallways. People are being discharged in 2 to 3 days after having major pelvic, rectal, or colon surgery.
I love that we're talking about the different phases of getting a diagnosis, again, starting with prevention. And it just seems like all across the board, wherever you are, things are getting easier, things are getting better, which, of course, is an attribute to all of the research and awareness that is created here this month.
It's very important. Things like National Colorectal Cancer Awareness Month our advocacy programs that we have through the American Society of Colon and Rectal Surgery, They've just been great, and all the research that's being done in prevention, and pushing the envelopes with surgery to make sure we get good oncologic resections and patients to get good, easy recovery so they can get back to their normal lifestyle.
I love that. And again, getting patients right in if they get that diagnosis is such a hard time for the family, but being able to do that, at least your best to do that.
No,
again.
That's the key, certainly. We want to try to help relieve that anxiety at Advent Health Tampa, and in my practice, it's always been, we focus not just on the physical ailment, but we really do focus on the mind, body, and spirit at our institution.
I love it. Well, I enjoy talking with you. It's always so educational. Of course, if you want to talk with any of the doctors at Advent Health, there's the information you see on your screen. And again, don't be hesitant to get screenings. I don't think we can say that enough, right?
Don't be afraid. We're there. We'll help you through it. Call us, talk to your primary care doctor. It doesn't have to be a challenging process for you.
Good stuff. Thank you again for coming on.
Thank you so much for having me.